Good evening, everybody. Welcome to the Spokane City Council Legislative Meeting for Monday, January 25th. We have a fairly light agenda this evening. Some of the matters that were originally on the published agenda have been deferred, but we are going to have a report from Dr. Velasquez from the Spokane Regional Health District talking about vaccines in a few minutes. So that should be very valuable. Before we start, I'd like to take a point of privilege this evening to recognize the life of Dr. Melanie Sanborn. She was tragically killed during the windstorm 2 weeks ago. Melanie was a pediatrician at Shriners Hospital, where she was beloved by both her colleagues and her patients. She was truly a woman for others and a shining example of brilliance in our community. Our hearts are with Melanie's family and friends as they grapple with this immense loss. To start our meeting tonight, I'd like to take a moment of silence, a moment for either prayer or reflection, in gratitude for all that Dr. Melanie Sanborn gave to our Spokane community. So please join me just for a few moments of silence, and I'll call you back. Thank you. We have one piece of business before we get to Dr. Velasquez, and that is on our boards and committees. We need a motion to...
Roll call.
We first, before that, actually need a roll call. So, Madam Clerk.
Council President Beggs.
Present.
Councilmember Burke. Councilmember Cathcart.
Present.
Councilmember Kinnear.
Present.
Councilmember Mumm.
Here.
Councilmember Stratton.
Present.
Councilmember Wilkerson.
Present.
Let the record reflect that all council members are present.
All right. Thanks. As I was saying, and thanks for the reminder, we talk about boards and commissions at this point in our meeting, and it turns out that when we adopted our boards and commissions assignment for council members last week, we forgot that the fire pension board member needs to be the chair of our finance committee, which is now Councilmember Wilkerson as of a week or so ago. So I'm looking for a motion to adopt our new updated council member spreadsheet, committee spreadsheet with Councilmember Wilkerson replacing Councilmember Mumm as being on the fire pension board. Is there a motion?
So moved.
Second.
All right, it's been moved and seconded. Any discussion? Hearing none. All those in favor indicate by saying aye.
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 Any opposed, nay? Any abstentions? All right, that is formally changed. Now I am very pleased to welcome Dr. Velasquez, who's been working around the clock and very diligently to be our local health officer. And we had reached out, I think, to the health district to say, boy, everybody wants to know about vaccines. When can we get them? How do we qualify? What's going to happen? And I know you don't know all the answers, but you know more than any of us here. So please let us and our listeners and viewers know the most that we can know at this time.
So good evening and thank you, Council President. It's a pleasure to be here. And I thought probably the best way to do it would be to go through a brief presentation that outlines what the process looks like. The reason for that is there has been a lot of confusion as to what the process is, where are we, how do we determine where do we go next, and the various models that we have and will use in the community to deliver vaccines. And as the Council President mentioned and alluded to, this is changing by the hour. Actually, two things changed in the last hour and a half alone, for the better, which is good. As an example, our rolling average in the state, daily average is about 23,000. It was 15,000 last week, so that's an improvement. So what I would like to do is ask Hanley if she could pull up the slides for me. She was kind enough to run this for me, make it a little bit easier for all of us. Thank you. And title slide, if we could go to, oops. Can everybody see the title slide?
Yep, and now we're already on
Could
to
you go
roles
back
and
for
responsibilities.
one, please? I think we went a little bit too far.
Okay.
Perfect. So title slide, then on to the next one. And the next one will tell us a little bit about what we're going to cover, roles and responsibilities. And the reason for that is this is a three-way system with multiple participants, where we are in the phases, what are the vaccine venues, a little bit about our providers, and some of the other issues that we have in terms of information, communication, and discussion. And I apologize if I lose my voice, but this is my sixth presentation today, so I'm starting to run a little bit raspy. Next one, please. So one of the areas that I want to make sure that we all understood is that this is a system that derives benefit from the federal government, the State Department of Health, as well as the Spokane Regional Health District and all of our partners. So the way the process is being set up is the Department of Health for the state of Washington or any other state is responsible, is actually the lead on the vaccination program. And that allows us to have guidance that is consistent across all areas in terms of priorities and allocations. We do have a single standardized process for providers to enroll. And as an example, the Spokane Regional Health District, we're a provider, which basically means we will get vaccine for distribution to not patients in our case, but for public health allocation. Department of Health manages the requests from all. And I can tell you we're all asking for vaccine, a lot of vaccine every day. The Department of Health also distributes directly to the providers. So as an example, Providence, Multicare, the Spokane Regional Health District, and many others are providers. So we get our shipments directly from the Department of Health. And more importantly, Department of Health has been providing a fair amount of materials in terms of communication. So the communication is fairly standardized across the state, which makes it a little bit easier to follow. I wanted to highlight then how do we work within that system. And one of the things that we've been very actively working on since the early beginning of the process of the anticipation of the vaccines through our advisory work group is trying to encourage as many providers to enroll in the program. We have, and that's one of the things that got updated in the slide later, but so far we have about between 100 and 130 that are in various stages of application in the process. We've also worked with many of our partners to ensure that there's an equitable distribution on the vaccines, and that is something that we're focused on, and it gets a little bit complicated because we basically never have enough vaccine as much as we want to give. And then lastly, part of our role is to make sure that we partner with as many community partners to ensure that we have multiple points of access for vaccine. And I'll mention a few of those as we go through this. But we have been managing that through an advisory work group, which is led by the district and meets every week and has fairly broad representation from the whole community. And that is how we've been working on the partnership. Next one, please. So throughout this process, there have been and there will continue to be some variables. And probably the single most important variable in the process is the supply. And supply available not only to the state of Washington, but as you know, this is a global project. So distribution of vaccine and the supply chain for the whole world is a complicated process. And is one of the areas where we've had occasionally a little bit of inconsistency in terms of request versus allocation versus actual shipment. And you will hear some of our providers mention that because it makes it a little bit more difficult for them to plan in terms of appointments. So this is a phased approach, going from the highest risk to the lowest risk, and that's where the phases that went through from A to B4, and that has changed as of a week and a half ago. And they all are in terms of risk for the individual, risk for the community, and risk for morbidity, mortality, and so on and so forth. One of the areas that we have been working with the state and locally through our equity task force, and the Spokane Regional Health District has an equity specialist or an equity officer, is dealing with vaccine hesitancy, which happens to be one of the areas that we have identified as a, not a concern, but a little bit of a challenge. And I can tell you, we have identified a number of groups, as well as a number of reasons for vaccine hesitancy. So we're trying to address those very specifically, and it could be cultural, it could be historical, it could be demographic groups. As an example, I can tell you I had this conversation with my 88-year-old uncle who lives in Iowa, who was very concerned about the vaccine. But on the other hand, I had the same conversation with my 88-year-old father-in-law who is in a nursing home in Buffalo, New York, and he was very happy to get the vaccine. So it varies, and I think our goal is to try to address that very specifically. And I can tell you with some of the, we're working with some of the community leaders to help us with that conversation in a very specific way. Next one, please. So about a week and actually about 9 days ago, this was the rollout. And the reason why I bring this up is because I want to highlight phase A1 and A2 and then B1, and then highlight the differences as we move forward as of last Monday into a different stage. So on phase A1 and A2, we were focused on how to protect the healthcare system and all of us that need care. So we focus specifically on high-risk healthcare workers. And as you've seen on the press and have heard from our partners that are in healthcare did a great job of working to immunize the providers that we all depend on to preserve hospital capacity and healthcare system capacity. Then the second line of defense are our first responders, EMTs and the like. And that's one of the areas where the health district could collaborate in a partnership with our EMTs. And if you recall, we had a clinic at the Spokane, the training fire facility of the Spokane Community College, which was a drive-through for first responders that was manned by the EMTs with support from our team. And that worked really, really well. It's a model that others are replicating around the state, and we will bring that back in the very near future. And when we talk about how that works in terms of the various models, I highlight that in a little bit more detail. Then we go on to those that are at risk, long-term care residents and long-term care patients. Now, B1, about 9 days ago, was like this. People over 70 and older, and 50 years or older in a multi-generational household. A multi-generational household doesn't mean a parent and a child. It actually means more than 2 generations. So typically, the typical example I have is one that I came across where we have a person who had a child, and the mother of the mother and the mother of the mother's mother, the great-grandmother, they all live together. So that's a multi-generational household. Next one, please. As of last Monday, as you know, the governor made an announcement and set forth a challenge for all of us providers, as well as made a couple of changes that I think are very helpful as we go forward. The first one being we moved on to Tier 1B, Phase 1B, Tier 1. And the question typically comes up, have we completed the immunization of all Tier 1, 1A, and Tier 2? And the answer is, for the most part, not totally, and I'll highlight that in a second. But one of the most significant changes, if you look at the slide, is we simplified the approach to people over 65 years of age, which is where the highest risk is for morbidity, and up to a point for mortality. So going back to 1A, Tier 1, and Tier 2, we're still working a little bit with some lagging healthcare workers for a variety of reasons. Not everybody can get immunized at the same time. And our partners, Providence Multicare and others, have done a great job of moving those forward. But we also have been working with long-term care facility residents as well as their staff. And the reason for that is many of the long-term care facilities became providers themselves. So they were able to get vaccine, but many did not. So the ones that did not needed to get vaccine and immunization through some of the partners, including the Spokane Regional Health District. We've actually deployed immunization teams to many of the long-term care facilities to make sure that it's taken care of. So we'll continue doing that until it's completed, and is work in progress that has advanced significantly over the last several days. Then when we move on to 1B, Phase 1B, Tier 1, the governor set forth another initiative that is very helpful, which is the deployment of the National Guard to set up and or participate in mass vaccination sites. And there are a number of those across the state. The place that was selected for Spokane was the Spokane Arena. Now, you may recall that last Monday, we also, in the community, launched a CHAS vaccination clinic at the arena. So when this announcement came out, we coordinated a conversation between CHAS, the National Guard, and providers. And the model that you're going to see opening to Wednesday, today is Monday, Wednesday this week, is one in which CHAS and the National Guard and us are providing a seamless process that is being enhanced with support from the National Guard, that CHAS will continue to be the primary provider because they're already set up and ready to go with that. And that is actually a very good model. We were on a call with Governor Inslee at about 4 o'clock today, where he was very complimentary of this collaboration because it allowed us to stand up a high volume facility for which the long-term target, and I say long-term, it may be several weeks, if not more, is to be able to immunize about 5,000 people a day, which is a very ambitious target. We'll probably have a soft launch with under 1,000 and make sure the processes work and then stretch that up to about 1,000 or so a day. So with that, we are providing access to those that are 65 years or older, or those that are 50 years or older and live in a multi-generational household. So the goal is to have that model be replicated smaller scale in other facilities across the county. And we have been working through the Regional Health District and our partners to identify other facilities that may be useful for mass vaccination, easy points of access in communities in various parts of the county. And there's a very creative process where we've assessed the possibility of utilizing example Gonzaga's athletic facilities, the Museum of Arts and Culture, particularly because of the 3-level parking ground. You can do a drive-through, and many other areas in the county. So more to come about on that, but I want to let you know that as I opened saying that there has been a good improvement. We were at 15,000 per day when we started all this. Today we end up the rolling average of 23,000 plus. So obviously we, as a community and with a state, are moving in the right direction. Next one, please. So I wanted to highlight that through this whole effort, and I mentioned equity and equitable process, we've been really focused on that, and not only in terms of background, but also in terms of occupation, activity, age group, risk, etc. So we're trying to do that in a very systematic, very thoughtful way. And this is something that if we had unlimited vaccine, we could really do it 100%. But I have told you, we're all trying to do the best that we can with the numbers that we have and being as equitable and as inclusive as we can be. And the process will continue. I just wanted to highlight that out because this is overarching principle within the phases, the risks, and the process. Next one, please. So I want to talk a little bit about the venues because that has been a little bit confusing for many of us in the community. That's not something that you have participated much in the past. So there are what we call traditional providers, and the traditional providers are going to be your typical healthcare providers, health systems, clinics, even doctors' offices can qualify, and other providers. And this come in two versions, either open or closed. And what we mean by open or closed, closed means I will only immunize my own employees. Open means I will immunize my employees and others. Now, we're very fortunate in this community that pretty much all of our providers have chosen the open model. And as you know, Multicare and Providence have been running mass vaccination clinics for the last few days too. And they were doing that before, in addition to their own employees. Some of this can be stationary for the most part. Most of them are right now. And the drive-through model is something that has been used and will probably use again in a number of places because it works very well. Then the pharmacies, there's 2 points here. We all know that typical times I can go to a pharmacy in the neighborhood and get my flu shot. We're not there yet, but we're also going to get there. But more importantly, the federal government has an agreement with two of our large pharmacy chains, Walgreens and CVS, to provide vaccines for long-term care facilities, those that are enrolled in the federal program. And as I mentioned, not all of them enrolled, but many of them did. So this is actually obsolete by now. We have more than those providers approved, and we have more pending approval. And I wanted to highlight that these are providers that will be able to receive and administer vaccine. Can you click on it too? And we'll get the second part of the slide, I hope. There you go. So this one, actually you can click twice so we can get the whole slide as well. Thank you, perfect. So this is what we call Enhance. And Enhance relies on the role of the health officer. So as a health officer, I have the ability to develop relationships with community partners whereby they can operate under quote unquote my supervision. Not only that, but I can also request under my standing orders vaccine for others that are not the regional health district. And we have a number of partnerships that I highlighted. We have now more than those, but I will highlight a couple. This is the model that we're utilizing, for example, in the correctional facilities, to deploy vaccine to correctional facilities. This is the same model we're utilizing for the school nurses who will operate under my standing orders, as well as the higher education institutions, and with the emergency medical services and EMTs. So I can tell you, for example, we developed the same liaison model with Union Gospel Mission, so the staff there can operate under my supervision to administer the vaccine. So that allows us to amplify the number of places and people that can do that and still get vaccine into my standing orders. We have also developed a couple of other models that we use for testing too, and I'll highlight that in a second, such as the pack and go, which is really what it means. We pack all the supplies and deliver and or get picked up to the various facilities where they have the staff that is able to administer vaccines. We have curbside models that have worked very well for clinics. And there's a term here called MRC, which is our Medical Reserve Corps. If you recall, about 2.5 weeks ago, the chief medical officers from Providence Multicare, myself, and the sheriff put out a plea to the community for volunteers in anticipation of more vaccine, in anticipation of needing more people, more hands-on, in addition to all of the staff that we have. And I can tell you that as of yesterday, we have over 200 volunteers many of them physicians, many of them nurses, many of them with various backgrounds. And that allows us to flex up our system. That is a federal program that is administered through the regional health district and allows us to bring people to the table that have specific skills. In addition to that, we are leveraging the volunteer services of our healthcare system. So as a physician, in other places that I've lived, I've been able to volunteer on emergencies covered by my healthcare system, but not providing services at my healthcare system, but providing services to the community. So both MultiCare and Providence are willing and able and very enthusiastic about doing that. We have, I lost count, but we have a large number of physicians that are willing to volunteer some of their time, which I think is true. Then there's other models. We have contracts with mobile nursing services, so we can deploy to areas where staff is not available. And then we have what I just mentioned, the mass vaccination events, which is the typical example is the one on chance right now. Next one, please. So what are some of the challenges people typically ask me? So we're trying to build this capacity of infrastructure up to about 45,000 doses a day. And notice I say build up the infrastructure capacity. I didn't say build up the number of vaccines, because we do know that it will take a little bit to get to that 45,000 a day vaccine doses. But the goal is to make sure that the systems are in place, we have the volunteers, we have the infrastructure, we're ready to go as the vaccine number increases. And as I mentioned earlier, we already went up several thousand in just a matter of a couple of days. So standing up this large-scale vaccine clinic, there's a lot of logistics. If you remember, the COVID vaccines are a little bit different than your typical flu vaccine. There's a pre-screening process, typical, similar to when you go to your doctor. There's a number of questions and a health questionnaire. Also an informed consent that you need to bring with you. Then you get your vaccine, and then you go into an observation area for 15 to 30 minutes, depending on your clinical history. So in the days of social distancing, having to stage patients like that, including the post-immunization observation, as you can tell, creates a little bit of a physical facility as well as a logistical challenge that we are addressing with in all of these large places that we have. So communication is important, and when things are moving fast, we're trying to all communicate as quickly as we can and in synchrony. Occasionally, the communication may not be perfect, but I can tell you that we're all trying very hard. We're all working together, the state, local districts, all of us and our partners, we're all trying to have the same message and make sure we're communicating as much as we can for the community. Because the moment that we've changed to phase 1B, obviously a lot of questions arose because of the change to 65 years of age, et cetera. Now, as you all know, not all providers have the same systems, and I will give you an example. If you look at the system that is going to be utilized for managing the patient flow at the Spokane Arena is going to be the CHAST system, as opposed to the Department of Health or anything else that the National Guard may have access to. And the reason for that is because that system works really well. People are trained, so it alleviates the concern about having multiple systems that may or may not interact and provides a more seamless flow. And then that allows the people to focus on the clinical activity as opposed to on clerical activities that are caused by different systems. We do this at a time when our healthcare systems and all of us have been pushing hard for a long time, but we're committed to moving forward. And then lastly, I think, as I mentioned before, there have been some concerns about inequity of potential distribution, so we need to make sure that we're as transparent as we can. And I can share with you, Lindia Wilson and I have been doing presentations in a variety of environments, in a variety of community activities and events to make sure that we share as much as we can about the vaccines. And I have one tomorrow morning. I had two earlier today. And we'll continue doing that because I think it is important to talk about it as much as we can. Because the more that we all know what the process looks like, the less complicated and the more we will trust it. Next one, please. So I want to highlight the many places that people can go in general to get information about the vaccine process. And I will encourage everyone to check our website of the Spokane Regional Health District, which is the srhd.org, and also to look at the Department of Health website. They have great information and has a lot of information that is very useful in terms of knowing not only where you are in terms of access to the vaccine, but also has a lot of information about why and how the vaccines work, et cetera, et cetera. And if you want, I will encourage you to sign up for the Department of Health newsletter, which is has a lot of information that is very well curated and very useful to all of us. And I think my next one is my last slide, which I will stop here and see if there are any specific questions on any of the areas that I cover or any other areas that people have questions. Thank you.
I saw Councilmember Cathcart's hand first. Go ahead.
Yeah, thanks, Dr. Velasquez. Great to see you. Appreciate the update quite a bit. I'm just wondering, you said there's a questionnaire that folks fill out prior to receiving the vaccine, and I guess I'm just wondering, is that questionnaire, are you looking for red flags that might be something where you wouldn't want to give them the vaccine? And if so, what would that be? Or is it looking more to determine which vaccine they get, the Pfizer versus the Moderna? Just kind of curious on that part.
That is an excellent question. Let me start at the end of the question, then backtrack. So there's a little bit of an echo. Sorry. Okay. So the vaccine that people receive is based on the provider availability. There's no preference for one or the other. And I bring that up because many of the providers, if you got Moderna, like we got Moderna first, that was the first batch we got. So pretty much what we're getting is Moderna for the most part. But there are other providers, such as Providence, that are a lot bigger, where they have some Pfizer and some Moderna. So there's no preference. Either one is fine for the person. The questionnaire aims to identify any medical conditions that could be of concern. As an example, anybody with severe food allergies is something that we need to know about. And we encourage people to go to the website and check out the ingredients of the vaccine. And I'm not talking about the messenger RNA. I'm talking about every medication has inert materials and other chemicals that are used to make it a solution. And we're encouraging everybody to look at that. And the reason for that, it doesn't mean that you won't get the vaccine or you shouldn't get the vaccine, although you should always do that under medical supervision. But the reason for that is you should get the vaccine if you have severe food allergies or a history of allergy or a history of allergies to vaccines. You should receive the vaccine in a place where they have the facilities to provide immediate care if necessary. So as an example, at the arena, we are going to have EMTs on site through the whole process, so they can provide any assistance, any medical assistance that is necessary. And that's a very important thing. It doesn't mean you can't get it. Always consult your primary care provider. But if you're going to get it and you have a severe history of food allergies or vaccine allergies, make sure that you do it at a clinical site and or one of the sites where you have either physicians, nurses, EMTs, trained personnel. So that's what the questionnaire looks at. And it's very typical, very similar to what you will feel if you go to a doctor's office for the first time and do you have any allergies, and so which ones, have you had any of the following symptoms? It looks very similar to that. That's a great question. Thank you.
Councilmember Mumm.
Hi there, thanks. We've been getting lots of calls from people in our district,
Thank you so much for the very comprehensive overview of where we've been and where we're going. But my questions that I'm actually getting from people is, how do I sign up? Where do I go? How do I find out where this is happening? And how do I get my appointment? I was helping someone today. I went on to sign them up for the arena. There's no information about when that's going to open up, what time they can start to make the appointment. It says some hours, but we just really could use that updated information. Thank you.
Thank you. I appreciate the question. That's a great question. So traditionally, for providers, prospective patients have gone to the Face Finder, but I have to tell you there is information coming out tonight about the arena to guide people very specifically for when it opens, scheduled to open, and I will say scheduled to open as of 2 hours ago on Wednesday. And information is coming out tonight to make sure it's in front of all, and it will guide people as to where to go, whether it's looking at my face in the DOH website, etc. So a lot more information will also be on our website, so people will be welcome to go and look in there, because we do understand that it's a little bit complicated since there's a lot of providers. And I've also heard that occasionally people have actually registered, got an appointment, but there hasn't been a vaccine available, at least where they were going initially. And that has to do with the supply chain. So I do want all of our community members to be somewhat patient with our providers, because they're planning, but they may not be getting what they're planning in terms of vaccine numbers. Like, for example, we asked for a couple of thousand, and we got about 800. And that's been the case. That brings me to another important point, which is part of the plan realigns some of the vaccine distribution to the mass vaccination sites to make sure that they have vaccine. But that also means that it moves a little bit from the rest of the providers there. So over the next couple of weeks, we'll have to learn how to balance that a little bit better. So a lot more information coming on that. There's a press release, and then there will be information on the website as well as on the Department of Health website. Great question. Thank you.
Councilmember Burke.
Thank you, and thank you, Doctor, for being here. I just had a question. I have heard that the vaccine, after about 6 hours, expires and needs to be used or it's thrown away. And I wonder what the solution is there so that we don't waste these vaccines, and if each provider is doing something different, or are we going to have a uniformed information about maybe how the general public could access that? I've heard some places are doing signing up for, leftovers. Like, how does that work, and where do we see that going?
That's a great question that has a lot of important points. So let me try to address them all, because I think this is very good information for the community. So first, providers have slightly different ways of dealing with vaccine appointments. And there's no uniform system thus far, because it all depends on what their setup is and what their capabilities are. So that's number one. I think number two, the vaccines, the Moderna and the Pfizer, they have slightly different temperature storage requirements. And Pfizer, for example, is a little bit more stringent in the temperature requirements than Moderna is, for example. But these vaccines will not survive for prolonged periods of time. So the direction that all providers have is to make sure that before you open the shipment, you have line of sight for utilizing every single one of the doses that you are opening out of that package. And we've had situations in which that has not worked out 100%. So we've actually moved vaccine around, and some providers have actually called on their waiting list individuals that have signed up but couldn't get in. That's how we've heard about individuals that may not have been exactly on the definition of the phase that is available, but the goal is not to waste any vaccine, and the goal is to really provide that to anyone that wants it and qualifies. So we're learning how to do these things. I can tell you in the first week or two, the reallocation from provider to provider is something that we haven't done, and it's something that now we have worked with. And the goal is to make sure nothing goes to waste. And I can tell you, at least locally of the district, not a single one has gone to waste, and we're over 90% on utilization on the ones we've gotten. And we have a long list of potential recipients that far exceeds the amount of vaccine that we have and probably the amount of vaccine that we will get. But I want to reassure people that it's not being wasted, it's being utilized. And the last point I want to make, which is something that you alluded to, if you have an appointment, please keep it. And if for some reason you cannot notify your provider, because that means that vaccine then can go to someone else that could utilize it. And one of the areas that has caused some confusion is all of these are timed appointments, typically, as opposed to first come, first serve, although that may change as the number of vaccine increases. And the reason for that is that, as I mentioned, there's a social distancing and a cadence that is required for these vaccines. So if you have an appointment at 5:15, well, make sure that you're there for the 5:15 appointment, not half an hour before or half an hour later, because it will cause a ripple on the distribution of the vaccines. So more to come on that. We are anticipating with some of the other vaccines that are in various stages of clinical trials around the country and around the world to have multiple options in the near future over the next couple of months, including one that is single dose and another that has more of your typical kitchen refrigerator requirements for storage, as opposed to like the deep freeze that Pfizer requires right now. And that's part of the vaccine development. One of the, I think, light at the end of the tunnel, at least that I keep looking at, is the fact that as a country and the world, we will have multiple options, and with those multiple options, it will allow us to not only address all the needs, but also geographical differences of access and communities where deep freeze storage may not be available, et cetera, et cetera. So that was a great question. I do appreciate that. Thank you.
Councilmember Kinnear.
Thank you. Question about making appointments if people do not have internet access or don't know how to use a computer. Is there a phone number they can call, or do they have to make an appointment online?
That's a good question. I think all providers have a phone number that can be utilized for access. And I will encourage people. I think let me get into this for a couple of seconds, because that's a very important point. Because not everybody either has internet or is internet savvy, and having other points such as phone numbers is a good thing. But one of the things that we're looking at deploying also is points of access in the community where people can come and be helped to get their vaccine as we increase the number of vaccines available. And we have spoken with community partners, faith-based organizations and others to help us look at that infrastructure so we can bring it closer to the people in the community, as opposed to having people go somewhere. Because not everybody can go to the arena, for example, although we're working on transportation for that too, by the way, to make sure people can go to the arena. But we're trying to deploy it as much as we can in the community, using as many points of access as possible. That's a good question. Thank you.
And Dr. Velasquez, I just wanted to translate. You keep using the word "go to your provider," and some people might not realize that just means go to the clinic you normally go to, the doctor you normally have, call them, and they will be your navigator. There's not a universal portal at this point. It sounds like there might be one in the future. But right now, whoever provides healthcare, doctor, nurse practitioner, go to them and they'll help guide. Is what I'm hearing. So,
Thank you. That is actually
yeah.
absolutely correct.
Yeah. Other questions from council members? All right. Dr. Velasquez, thanks for, I'm sure you work late every evening, but thanks for hanging out with us and all the presentations and all that you do. And I agree with you that we've made great progress just in the last few weeks, and it's only going to accelerate. So thank you so much, and we'll let you go to your evening, and we'll go back to the rest of our meeting. I did want to, even though we're in the midst of a pandemic, we had a Finance Committee meeting today, and we asked, hey, what were those annual construction values this last year? Oftentimes we get that at our committee meetings, and we were sent that this afternoon, and I was super excited to announce that we had $585 million in annual construction value permits last year, which is the highest perhaps in Spokane history, but at least for the 20 years that they listed, was pretty significant. And, 2013, I think it was only $326 million a year. Last year it was only $402 million. So, and couldn't come at a better time. Of course, not all of that value gets spent in 2020. A lot of it's going to be spent in 2021. And of course, even though we were all on the council in 2020, the work to get us there was many years coming for all sorts of people in the private sector and government. But I just thought that was some good news and supports my belief that as we get the vaccines and herd immunity, our economy is just poised to continue to be strong in Spokane. So we just need to stay safe, stay healthy as we can, and our fundamentals are good. So I was excited to hear that. So we will turn to our legislative agenda. And if you'd like to read the first resolution, Madam Clerk.
Resolution 2021-0006, approving settlement agreement and general release of all claims of Jessica Warren settled through mediation.
All right, and we were briefed on that in an executive session. There's no public comment. Is there any council commentary before we vote? All right, seeing and hearing none, I'll take a roll call. Councilmember Mumm.
Aye.
Councilmember Stratton.
Aye.
Councilmember Kinnear.
Aye.
Council President's an aye. Councilmember Burke.
Aye.
Councilmember Cathcart.
Aye.
Councilmember Wilkerson.
Aye.
All right. That resolution passes 7-0, and those documents will be executed. We deferred the next ordinance on the Yellowstone franchise, but we're now down to another ordinance. If you would like to go ahead and read that, Ms. Pfister.
Ordinance C 35998, requiring a supermajority council vote for the approval of intra-fund transfers of budgeted personnel expenses to non-personnel expenses or between departments, amending section 7.09.010 of the Spokane Municipal Code.
And we substituted some language earlier today, but not particularly substantively. Essentially, this is something council announced a little over a year ago, but we delayed for a year due to the pandemic economic impacts. But it essentially means that if we approve a budgeted position, the administration doesn't have to hire that person, but they can't use those funds for another position or another expense without coming back to council, since council sets the budget. We don't have any public comment signed up for that. Is there any council commentary? All right, hearing and seeing none, we'll have another roll call. Councilmember Mumm.
Aye.
Councilmember Stratton.
Aye.
Councilmember Kinnear.
Aye.
Council President's an aye. Councilmember Burke.
Aye.
Councilmember Cathcart.
Aye.
Councilmember Wilkerson.
Aye.
All right, That passes 7-0. Next ordinance, please.
Ordinance C 35999, establishing a strategic reserve account within the general fund and establishing the process for the annual allocation of positive general fund variances to the various reserve funds, amending section 7.08.010 of the Spokane Municipal Code.
Very similar to the last one. We announced that a little over a year ago, but delayed it, and we substituted again some technical language changes. Essentially, this would do two things. One, it creates a new strategic reserve account that when we have money in good times, we can put money there and it'll stay there until there's an initiative that the city wants to take on. But we also clarified that the order of reserve accounts, that the other ones are filled up first, and that includes the contingency reserve account and the revenue stabilization reserve account. And as we have those reserve accounts fully funded, that helps our bond rating and many other things like that. But this just adds the strategic reserve account without taking away from those high priority reserve accounts. Any council commentary on that? Councilmember Mumm.
I just want to say thank you to all the council who have supported this process. This is really a phase 3 of our reserve accounts. And as many of you may recall, about 8 years ago, we were at zero. We were not saving for reserves and kind of operating. We had some, but they weren't protected in any way. And so through a series of new code and new rules and the leadership of this council, we have now fully funded both the revenue stabilization and the contingency reserves, and now this third strategic reserve, which really gives us flexibility to do the things that we need to do to meet our strategic goals in the city. And I'm just really proud of us to take this lead, and when we do go for getting our bond rating, we'll be in the best position to put our foot forward to get the best rate for our citizens. And I also want to mention that in 2020, during a pandemic, we were able to come out in 2021 with having these fully funded, which is just outstanding. So I think it really shows that Spokane is on solid footing.
Agreed, and also special kudos to Tim Dunavant, our budget staff person who helped us craft these, working with Chief Financial Officer Tanya Wallace as well. So appreciate that. Any other commentary? All right, we'll have a roll call on this. Councilmember Mumm.
Aye.
Councilmember Stratton.
Aye.
Councilmember Kinnear.
Aye.
Council President Sinai. Councilmember Burke.
Aye.
Councilmember Cathcart.
Aye.
Councilmember Wilkerson.
Aye.
All right, that passes 7-0. We deferred the updated special events ordinance till March 8th so that the administration could take some of the feedback we got from parade organizers and work out a few more details on that, but we're getting close. And that brings us to first reading ordinances.
Ordinance C 36004, relating to amendments to the existing building and conservation code, sections 17F.070.470 and 17F.070.490 of the Spokane Municipal Code, and Ordinance C 36005, relating to the rates for sewer charges, amending Spokane Municipal Code, section 13.03.1010 to chapter 13.03 of the Spokane Municipal Code, and setting an effective date. Further action is deferred on the first reading ordinances.
Right, we have one person signed up for open forum. That's Carol Ellis. If you want to hit *3, Ms. Ellis. Not seeing Ms. Ellis yet, but in case she's watching on video, I just had one announcement for next week, and that is we're going to have our first presentation by neighborhoods. We used to have town halls where we would take 10 or so neighborhoods at a time and hear from them all one evening. After consultation with the neighborhoods and neighborhood services, instead of doing them all in big batches, we're going to just start doing one or two a meeting. And next week will be West Hills, so we'll hear from them. Last call for Carol Ellis. There's someone here. I'm just gonna. Oh, go ahead. There's someone on the line.
This is Carol. Yes, this is Carol Ellis.
Yes, Carol. Welcome to the meeting. You have 3 minutes, and I'll just tell you when you get to the end of it. So feel free to start and tell us what's on your mind.
Thanks. Thank you. Thank you, Madam Mayor, Council Chair Beggs, and members of City Council. As a resident of Spokane, I know that you are working daytime, nighttime, and overtime for the residents of Spokane. As a resident, I ask you to reconsider the trajectory which is leading too easily without enough legal and governing decision-making on the part of many city entities. The parks are independent by city charter. It's unique in the state of Washington. And it seems that right now the trajectory is coming from public utilities to engineering and to the city council, and finally back to parks. Because parks did not give a solid no at the land committee meeting on January 6th, then engineering, which I'm calling it special project because they've taken it under their wing, they are routing it themselves with the survey. I believe the survey belongs in the hands of parks. I believe that the process must involve the 2 new park members that came in this year, 2020, and also 2019, and that the legal opinion referred to in the January 6th Land Committee meeting needs to be shared with the public. It is not currently on the minutes of January 6th or January 14th when it was the whole park board. A member of the board of Friends of Hamblin Park asked to see it. It has not been forthcoming. And I believe that an exchange is occurring with parkland to be taken for a water tower in Hamlin and the partnership that has been proposed in the Garden District. And I believe there are legal issues there that have not been examined, and that is the public's right to be part of the legal opinions that are coming down the file. Where there's limbo with the legal and the governance, there's also limbo with the survey. It seems that the outreach for the survey will come only online. Hearing the discussion on COVID, we know there are people, concerned residents, who don't have the access and don't have the information, and that it belongs with Parks and Friends of Hamblin Park to be involved in this process, which has been taken over by engineering. And engineering is not the be-all and end-all for the operation of Spokane Parks. We found that out when a mall was approached for Murphy Park, when a 9-story climbing wall was approached for Central Riverfront Park.
Ms. Ellis,
and I wanted
you've come to the end of your 3 minutes. Thank you.
Good evening, all.
Yep. Thank you so much for bringing us your opinion on that. And with that, we don't have anyone else signed up for open forum this evening. And so we will be adjourned until next week.